This jelly lining in the bladder, if part of that comes away, you would pee that out.
Last month, the National Health Service in the UK opened their first ever clinic for children who have damaged their kidneys by taking too much Ket. It's based in 𝓴𝓮𝓽𝓪𝓶 in Liverpool, and it's the first of its kind in the UK. They say it's been set up in response to a significant rise of young people presenting with ketamine-induced uropathy, also known as Ket Bladder. So I went down to Liverpool to meet the professor who runs the service to learn a bit more about it.
So my name's Professor Rachel Isba, and I'm a consultant in paediatric public health medicine here at 𝓴𝓮𝓽𝓪𝓶 Children's Hospital and Professor of Children and Young People's Health at Lancaster University.
Okay. Why does this clinic exist? Why was it set up?
Yeah, that's a good question. So probably towards the end of last year, start of this year, my colleagues in urology at 𝓴𝓮𝓽𝓪𝓶 here were starting to get referrals of children and young people under the age of 16 who had bladder complications as a result of their ketamine use. And so there were a few referrals, and then there were a few more referrals, and so we thought actually we could probably benefit from bringing all of these children and young people together to a focused clinic where they could see the urologist, talk about their bladder issues, but then I could also join the clinic and talk to them about their Ket use, give them some harm reduction advice, make sure that they were connected with their local drug and alcohol services if that was something they were able to engage with at the time, just to sort of start a conversation, because the best treatment for ketamine-induced uropathy or Ket bladder is to stop using the ketamine, and that can be quite tricky. So we figured a sort of holistic approach to young people was probably going to be beneficial.
Is there a typical sort of pattern of use that results in someone being referred to this sort of clinic, or can it be different for different people?
Yeah, I think it's different for different people. The longer the exposure or the higher in terms of amounts being used, but it's really variable. And I think because we're seeing more ketamine bladder now than, ketamine bladder has been an issue for longer in older populations, so in young adults, but it's quite new in children. We don't really know that much about it. There's loads more research that needs to be done so that we can answer questions like that.
And is it that many more young people and children are using ketamine?
I think we're not sure, because there are some data that are collected nationally and some data that are collected locally, which give us an idea of how many under 16s, for example, might be using ketamine. And then there are some national figures that show of the people under the age of 18 who are engaging with drug and alcohol services, how many of them report using ketamine. And in the under 18s, that has gone up over the last few years. And then there are other measures of how much ketamine is used generally in the population. So there's a wastewater survey where they measure the drugs, various drugs in sewage, basically. And over the last few years, that's sort of nearly doubled. So it's gone up by 85% over the last few years. So I think patterns of ketamine use are changing, even though it's been around as a club drug since the 90s. I think the profile of the people that are using it is changing, and the way in which it's being used is probably also changing. But again, a lot more research needs to be done to answer those sorts of questions.
Do people give us sort of like motives of why they're using so much ketamine? Because obviously dissociative, so it's quite a, if you want to be splintered from reality that much, do people give a motives of perhaps why?
So we don't tend to explore that in clinic. I think there is some research in young people, so older than the group that we would look after, who do offer some reasons why they'd use it. But as I say, it's not something we really explore in clinic. We tend to focus on trying to improve their symptoms and making sure they're getting the support that they need. And there's a very specific way we go about doing that, because they're children and young people, and the approach that we use. So yeah, we don't really explore that masses.
Okay. Is there like a general, obviously the more that people use Ket, the more likely they are to have this sort of physical damage?
Yeah.
And do we know roughly how much people would be using before they have, for instance, bladder damage?
No, it seems to be quite variable, and not everybody that uses ketamine goes on to develop bladder issues. So there are lots of unknowns, I think, at the moment. So we don't know what would make somebody more or less likely to develop bladder issues. And at what point, or how that relates to how much they're using. Yeah.
Can you explain what happens in the body when someone takes ketamine?
So as you say, it's a dissociative. So it's been used as an anaesthetic. I think it was developed in the 60s. So we use it in clinical practice. So for example, I've used it in a previous job when I worked in the paediatric emergency department. We'd give somebody some ketamine to replace a dislocated shoulder. So what it does is it makes you not aware of what's going on. So you're pain-free whilst something painful happens, and then it wears off relatively rapidly. And you know that something's happened, but you don't have any memory of what's happened. The way that it's used recreationally or in a non-prescribed way, there are several different ways you can use it. It's most commonly snorted, but the way that the pattern that people use is very different, and that varies, I think, again, depending on how old the users are. So again, we don't really know masses about why the children and young people are using it or how they're using it. But if you use more over a longer period of time, you're probably more likely to develop bladder symptoms, is about, as much as we can say in this population.
There's a lot of individual differences, so it's hard to say if you use ketamine, every day for a year. It's difficult to say things like that.
Yes, but if you use ketamine every day for a year, you're more likely to develop bladder symptoms than if you use it once on a weekend for 6 months, for example. Obviously not set in stone and people are very variable, but yeah, it does seem to be related. And one of the reasons is, so what happens is when you take the ketamine, your body breaks it down, and then one of the chemicals it gets broken down into irritates your bladder. So you then get stuck in a cycle where your bladder becomes irritated, and it's got a lining, so the lining might come away because of the irritation, and then the chemical is touching the bladder directly. That can cause a sort of ulcerative pattern. Then you might have blood in your wee. That's very painful. And then unfortunately some people will get stuck in a cycle of treating that pain because ketamine's an anaesthetic with ketamine, and then that makes it worse. And then eventually what happens, you'd be better asking my colleague Harriet because she's a urologist, but if you think of the bladder as a balloon, it expands and you can get a certain amount of wee in it. The ketamine sort of shrivels it up a bit and it's more painful, so it holds less wee. And the wee, then you have to go to the toilet a lot because it holds a smaller volume and it's irritated. And then unfortunately what happens is the chemical that's in your wee sort of sits in your bladder, but then can sort of go back up the tubes to your kidneys, and then you can get the same process in there, and then ultimately it gets into your kidneys, which is why in these older populations you see people with urostomies and nephrostomies, which is where a bag collects your wee straight out of your kidneys effectively.
And at that stage, is it reversible or not?
I think if it gets to your kidneys, I'm not 100% sure, because again, we're seeing younger populations. We are seeing an element of reversibility, and I think they're seeing that in older people as well when it's at the bladder stage. But again, the most effective way to treat it is to stop using the ketamine. And if you're, in a dependence pattern with that, that's extremely difficult to do. And what also we need to do more research on is effective ways to manage the pain that's not using ketamine. So there is a reversible element, but how reversible it is and at what stage, and if you carry on using ketamine, I think we're just learning more about that, particularly in this younger age group.
And so what are the early warning signs of physical damage from ketamine use? So if someone's watching this video, they might have spotted some of these signs in themselves.
Yeah. So tummy ache, so and that might be because of your bladder, which sits towards the bottom of your tummy, or other forms of tummy ache. So actually we talk a lot about bladder issues, but ketamine can also affect your liver, for example, and that's in a smaller number of people again. But if you've, tummy ache or going to the toilet a lot more, and it being really painful. So it's a sort of cystitis. So it can feel a bit like a wee infection, for example. And then if you do this jelly lining in the bladder, if part of that comes away, you would pee that out. So people describe jelly in their wee, which is obviously terrifying. And then, like I say, blood in the wee as well. But pain is very common.
Is that what some people refer to as the Ket cramp?
So Ket cramps could be the bladder, or it could be the belly, the more sort of general bellyache.
So if someone takes ketamine recreationally and they're noticing some of these symptoms, what's the best course of action for that individual?
So obviously, if they're unwell, they would need to seek medical help in the same way they would for anything. If they have identified that it's related to their ketamine use and they're not already engaged with local drug and alcohol services, but they feel able to be, that is a great first port of call. There's lots of useful stuff on, for example, the Talk to Frank website is brilliant.
All right, guys, I just wanted to point out a small conflict of interest with this last comment. Not my last video, but the video before that was an investigation or a sort of expose on Talk to Frank. And although there was some correct information that the organisation was putting forward, I did find that they struggled to answer basic questions about drugs. And so if you want to watch that, you can check it out in the description. I'll also put it at the end. But if you're finding this video useful or interesting, do me a favor, subscribe and click the bell notification next to my name to get the videos first.
It'll give you loads of details, things. It'll talk about the things that we've just talked about in terms of symptoms. There's, sources of help. I think you can look at where you are and they'll tell you somebody nearby. So there are forms of help out there for people. And I think as a profession, as doctors, we're learning more and more as we go along about this. But it might be that if you go to see your GP, they've never looked after somebody who uses ketamine before. So be upfront about drug use. It's a really important bit of the clinical picture, and it will help your doctor or nurse, whoever's looking after you, work out what's going on for you and work out the best way to treat you. And I think there's a lot of stigma still around drug use. Lots of people use drugs. It's a shame about the stigma because it stops people from getting the support that they need. So I guess encouraging people to ask for help, but to mention the ketamine use because it's a super useful bit of working out what's going on clinically.
Is there any ways that people can reduce harms of ketamine? Obviously not taking it is the best thing.
Yeah.
But is there any harm reduction stuff?
Yeah, so particularly in younger populations who are more likely to have accidents than people, for example, in my age group, we would give them advice about staying, if they are continuing to use ketamine, how they can stay safe. So, you may feel invincible, but please don't climb that tree. Encourage your friends not to do it. And because we're talking to children and young people, sometimes we won't use a direct approach. So I won't say, look, if you're going to use ketamine, please don't do this. We might say, if you're with your friends and you're using it, these are ways that you can support yourself and your friends to stay safe. So accidents is a big thing, staying away from water, so bodies of water, so canals or, going for a swim when you've used it, Not using more than one substance at a time. So, for example, if you drink alcohol and take ketamine, your perception might be further altered, so you might be more likely to have an accident, for example.
And that's because it's two central nervous system depressants.
Yeah. So two things that are going to affect how your brain works.
Yep.
Yeah. And then we will also talk about, if just generally, if there's an emergency, do you know how to call for help? It's important to call for help and say what's gone on. Do you know how to put your mate in the recovery position? Things like that. So it's what it isn't is we're not saying you need to stop now. It's very bad. We're adults. We're telling you what to do. What we're trying to do is encourage them to make some more positive choices, and whilst they're doing that, make sure that they're as safe as they can be.
So the two main risks that you've mentioned here is the long-term effects for your bladder and your liver. In the short-term accidents, is there any other main risks of ketamine?
I think those are the two things. I think we'll probably find out more in the future. Like I say, I think it's unlikely to just be bladder, and there is evidence again in older populations that, for example, the liver can be involved, and we might be seeing that more in the future. But I think also there's a big unknown amount. So we don't know if, for example, a child comes to the emergency department and they've got really bad abdominal pain, so really bad tummy ache, and we can't work out why, and they haven't said or nobody's asked directly, then there might be quite a few people coming to hospital that we don't know are coming because of their ketamine use. Equally, there might be people having accidents. So, if you fall out the tree and you break your leg, unless somebody specifically asks, we might not know. So it's possible that there are other things going on, but because we're not collecting specific data, we're not sure what role ketamine is playing in that.
Right, because of the illegal nature and the social stigma, it's hard to get pure data on it, basically?
Yeah, so I think some of it is we don't ask. It's probably quite difficult to be honest. And I think if you're a young person and somebody's asking you about drug use, it would have to be in a very specific way that you knew nobody would find out because of all the reasons that you've just outlined.
Yeah. But just back on the harm reduction thing again, I've heard of a rumour that when people take it, if they then spit it out, rather than this was a question from one of my followers.
Right.
That once they've snorted it, when it collects in their throat, if you spit it out, that can reduce some of the harms.
I have absolutely no idea. That would be a very interesting scientific experiment. I mean, if you think about it from an absorption point of view, when you snort it, some of it will be immediately absorbed by your nose. I guess all you're effectively doing is spitting out part of the dose. But I don't know that there's any evidence to support that.
Fair enough. Another thing that there seems to be a misconception around is because of ketamine-assisted psychotherapy. Like someone said to me once, well, I can't get on I'm on the waiting list for mental health support on the NHS, but it's going to be like a year. But, ketamine's great for therapy. And can you tell the big differences between recreational snorting of ketamine and ketamine in the clinical setting?
So I don't know. And again, I don't think anybody's using it in children for that. I think we're probably in the early days of that. But I think the important distinction is there is medical grade ketamine that is given in a very controlled way in very specific doses over a certain pattern versus if you're buying something in the street, you genuinely don't know what's in it. You won't measure it out in the same way. So actually, even though they're the same drug, prescribed ketamine and non-prescribed ketamine are probably two different substances. In the same way that if you buy an illegal cigarette, it's different to getting nicotine replacement therapy. So I think that has complicated things though. And there will be people, I imagine, using it to self-medicate, as has always been the case with lots of other substances, for things that are going on.
So if the message is, if that's you, then maybe you need to get onto the underlying causes of using it.
So, well, I think there's evidence, again, in adults that there's a lot of people that use ketamine have got trauma in their lives, and which is obviously intricately related with mental health issues. And so, yes, I guess in that respect. But again, I think the children and young people that we care for, they're all under the age of 16. Things are very different to if you're 25, you might be using it for different reasons. I think it's probably complicated.
Yeah. Is there any other misconceptions about ketamine that people should know?
I think that important distinction between something you might get prescribed in a very specific set of conditions at a very low dose that's medical versus buying, with anything, buying something on the street could have anything in it. I think that would be they're not the same. Even though they're called the same thing, I wouldn't regard them as the same thing. And I think the harm reduction thing. So I think, people might be accessing this content and thinking, I can't stop, but I would encourage them to think, what makes you use more ketamine or what makes you use less ketamine? And can you do more of the things that when you're doing them, you use less? Or can you have a think about, keep a diary? Can you think about what might be a trigger for you to be like, actually, this is a bad day, I need to do this, but is there something else? It sounds really straightforward and basic, but I think it's true for lots of things. In the vaping clinic, we'd have a similar conversation. What makes you vape more? What makes you vape less? But I think having a little bit of a think about the patterns of an individual's use, they might find something they hadn't thought about before that they can change. And with all of these things, making any positive difference is a positive difference. So it's not all or nothing. And I think sometimes it can feel like that, again, because of the stigma and, the illegality of much of it. But actually, even small positive changes are positive changes.
Absolutely, yeah. And I think that it's just comparing ketamine-assisted psychotherapy to recreational ketamine is like chalk and cheese, isn't it? Because obviously in a medical setting, you're going to be given very controlled amounts for a very short period of time, and you're going to have someone monitoring you. So the danger of falling over, etc., is non-existent. And the danger of having enough for the long-term problems is non-existent as well. So I think it's really unhelpful when people...
But I think it's confusing. I think because there are plenty of facilities offering, the private facilities offering ketamine in a medical way. And I think if you're a young person and you don't know how the health system works or you don't know that those are two different things, it's quite easy to for the water to get muddy.
Yeah. Would you class ketamine use amongst young people as a crisis?
I guess it depends how you classify a crisis.
Yeah.
I think it is something that we need to do something about urgently. And when I talk about young people, I'm talking about children.
Yeah.
I would call them young people to their face because that's what they want to be called, but they are, in the eyes of the law, children.
16 and under.
Yeah, or even 18 and under. But yes, here we would care for people 16 and under. And my concern is that if there is, which there will be, a population of under 16s who use non-prescribed ketamine and want to stop, we as a health service, and as a country need to be able to provide the support for them to do that. And again, that's coming back to the clinic. That's why I go to the clinic, so that I can make sure they can access support.
People have been using Ket recreationally on the party scene for over 30 years. But if you look at some of the stats, it seems that people are getting on it more recently in the last few years. According to the latest government stats, Ket use in England and Wales has more than doubled since 2016. Usage amongst 16 to 24-year-olds has tripled in the same time frame. 269,000 people aged 16 to 59 reported using Ket in the year ending March 2024. While the vast majority of people who use Ket do so in moderation, some healthcare providers have said that they're seeing an increase in bladder issues amongst young people due to chronic Ket use. As a result of this, the government want to put Ket up to a Class A drug. They've been talking about that a lot recently. It's currently Class B under the Misuse of Drugs Act 1971. The higher the drug goes in the categorisation, the more harsher the penalties are for possessing or distributing that drug. However, history has taught us that the classification of the drug has no correlation whatsoever when it comes to how many people will use the drug. So it's probably going to do absolutely nothing when they take it up to Class A. What might actually help, however, is giving harm reduction advice around ketamine for people that have decided they're going to use ketamine anyway. So here's some information how you can reduce the potential harms of the drug. Don't use ketamine alone, always do it with trusted friends. Stay hydrated. If you drink water before, during or after taking Ket, that can potentially reduce bladder damage, but no more than half to 1 pint an hour. Go low and start slow. Start with small amounts of Ket, spaced apart, and see how it affects you. Avoid mixing Ket with any downers. That includes alcohol or some prescribed medications, because that can increase the likelihood of you falling over and injuring yourself. Don't use ketamine in a dangerous place, for instance, anywhere high where you could fall off, or near any large bodies of water. Again, that could result in accidents. Brush the powder finely to reduce damage to your nasal passage. Also, you could wash your nose out with a saline solution at the end of the sesh. Again, that could reduce damage to your nose. Don't share snorting equipment. Use your own straw and don't share it. Sharing equipment for snorting drugs can result in the transmission of communicative diseases like hepatitis, for instance. So there's some actual practical things that could actually potentially reduce the harms of ketamine. But what won't reduce the harms of ketamine is, putting it up to Class A, which is going to do, let's be honest, sweet fuck all.